Is your body whispering a warning? Have you ever wondered why some people discover cancer only when it's already too late? It's a heartbreaking reality. According to the World Health Organization, nearly 50% of all cancer cases are diagnosed at a late stage, when the chances of successful treatment drop dramatically. And yet what most people don't realize is that the body often sends quiet, almost invisible warning signs long before things reach a crisis point. But here's the part most people miss. These signs aren't always loud. They don't always come with pain or dramatic symptoms. Sometimes they appear in the most ordinary ways, things you might even consider good news. That's why today we're revealing the 10 warning signs of cancer that many people ignore. Because awareness could be the most powerful weapon you have to protect yourself and your loved ones. So let's begin with one of the most dangerously overlooked signs. Section 1. Unexplained weight loss, when good news isn't good at all. Imagine stepping on the scale one morning and noticing you've lost several pounds without even trying. At first you might feel excited. After all, losing weight, especially after the age of 50, can feel like a small victory. Friends may even compliment you, asking what your secret is. And without thinking much of it, you move on with your day. But what if I told you that this seemingly positive change could be an early warning sign of something far more serious? Medical experts reveal that over 40% of people diagnosed with cancer report significant unexplained weight loss before their diagnosis. This isn't the kind of weight loss that comes from dieting or increased activity. This is a rapid, unintentional loss of 5% or more of your body weight within 6 months, without any clear reason. Why does this happen? Certain cancers, like those of the pancreas, stomach, lungs, and esophagus, can disrupt the body's ability to absorb nutrients. Some even produce substances that dramatically increase your metabolism, causing your body to burn calories faster than normal, even at rest. But here's the truly dangerous part. Because there's no pain or immediate discomfort, this warning sign is often celebrated rather than investigated. People simply assume their body is finally getting back in shape, when in reality, it's a quiet cry for help. If you or someone you know experiences sudden unexplained weight loss, especially if it's more than 10 pounds without trying, it's time to pay close attention. Don't wait for other symptoms to appear. Talk to your doctor. Run the necessary tests. Remember, early action can make all the difference. And this is only the beginning. The next sign is something even more subtle and far too easy to dismiss. Section 2. Persistent fatigue, when rest isn't enough. We all feel tired sometimes. A long day at work, a restless night, or simply the natural slowing down that comes with age. But have you ever felt a deep, bone-crushing exhaustion that sleep just can't fix? This isn't ordinary tiredness. It's a kind of fatigue that lingers, day after day, robbing you of the energy to do even the simplest things like cooking a meal, taking a short walk, or enjoying time with your grandchildren. And here's the part most people miss. Persistent, unexplained fatigue can be one of the earliest signs of cancer. You might assume you're just getting older, or that stress is catching up with you. But when fatigue doesn't go away with rest, and no amount of sleep seems to refresh you, it's time to listen to your body more closely. Medical studies have linked this type of profound exhaustion to cancers such as leukemia, colon cancer, and stomach cancer. These cancers often drain your body's resources silently. In leukemia, for instance, abnormal white blood cells crowd out healthy ones, leaving your body constantly struggling to fight off infections and perform normal functions. And yet many people dismiss this warning. They push through their exhaustion, sipping more coffee or blaming it on age. But what if that feeling of constant tiredness isn't just a result of getting older, but a critical signal that your body is fighting a hidden battle? So how can you tell when fatigue becomes a concern? If your exhaustion lasts more than 2 weeks without any clear cause, if you wake up tired despite a full night's rest, or if simple daily tasks leave you feeling completely drained, it's time to consult your doctor. Don't accept persistent fatigue as the new normal. Your body may be trying to tell you something far more serious. And speaking of hidden warnings, the next sign is often mistaken for the aches and pains of aging, but it may be something much more dangerous. Section 3. Chronic pain, the silent messenger. We've all heard the phrase, "it's just part of getting older." Aches in the joints, a sore back, or nagging discomfort in the neck, these are often brushed off as normal signs of aging. But what if I told you that sometimes this kind of lingering pain is your body's silent way of saying, something is wrong? Chronic pain that doesn't go away, or worse, grows steadily over time, should never be ignored. Here's why. Persistent, unexplained pain is one of the most overlooked early warning signs of cancer. Depending on where it occurs, it could point to different types of cancer. Lower back pain can be linked to cancers of the kidneys, prostate, or ovaries. Pelvic pain might indicate ovarian or uterine cancer. Constant headaches that don't respond to typical treatments could be a sign of brain tumors. And yet most people try to explain it away. It's probably arthritis. I slept wrong. This is just part of getting older. But here's the critical difference. Pain from everyday issues like muscle strain or arthritis tends to come and go. It often improves with rest, heat, or medication. Cancer-related pain, however, is stubborn. It lingers. It may worsen at night or while resting, and it often doesn't respond to normal treatments. Take, for example, persistent bone pain. This could be a signal of bone cancer or cancers that have spread to the bones like breast or prostate cancer. If you or a loved one is dealing with unexplained ongoing pain that lasts longer than a few weeks, especially without an obvious cause, don't just endure it. Listen to what your body is trying to say, because sometimes the most dangerous signs are the ones we accept as normal. And while pain is hard to ignore, the next sign is even more deceptive. It hides in plain sight right on the surface of your body. Section 4. Changes in skin, more than just aging. Our skin is like a mirror. It reflects what's happening deep within our bodies. Yet when subtle changes appear, most people hardly notice, or simply dismiss them as signs of aging. A new mole. It's probably harmless. A dark patch on the skin. Maybe it's just sun damage. Yellowing skin. It must be something I ate. But here's what many people don't realize. Your skin is often the first to show warning signs of internal health issues, including cancer. Let's start with something many people ignore. New or changing moles. Especially ones that change in size, color, or shape could be early indicators of melanoma, the most dangerous form of skin cancer. Sores that don't heal, particularly around the mouth or on the skin, may point to a basal cell carcinoma. Oral cancers, especially in those who smoke or consume alcohol regularly. Yellowing of the skin and eyes, also known as jaundice, can be a hidden signal of liver or pancreatic cancer. Unexplained dark patches or velvety thickening of the skin, usually around the neck or underarms, might indicate an early warning sign of insulin resistance or even gastric cancer. But here's the part most people miss. These changes often don't hurt. They aren't uncomfortable. And because they develop gradually, it's easy to ignore them until they become impossible to overlook. So what should you watch for? Moles that are asymmetrical, have irregular borders, or show multiple colors. Sores or lesions that don't heal within 3 weeks. Skin that becomes suddenly rough, darkened, or unusually velvety in texture. Yellowing skin or eyes accompanied by unexplained weight loss or fatigue. If you notice any of these changes, don't delay. Early detection is key, especially for skin cancers, which are highly treatable when found early. Your skin is more than just a protective barrier. It's a storyteller. And sometimes it's telling you a story you can't afford to ignore. Now let's talk about a warning sign that's easy to overlook but could reveal one of the most common and deadly forms of cancer worldwide. Section 5. Changes in bowel or bladder habits, the hidden clues few talk about. Let's be honest, this isn't the most comfortable topic to discuss. But sometimes the most critical health warnings are hidden in the most private details of our daily lives. And if you've noticed sudden changes in your bowel or bladder habits, your body might be trying to get your attention in the only way it knows how. Here's what many people overlook. Colorectal cancer is the second leading cause of cancer-related deaths worldwide. Yet early signs are often dismissed as simple digestive discomfort or age-related issues. So what are the hidden clues you should never ignore? Persistent constipation or diarrhea that lasts more than a few days. A sudden change in stool color or shape, especially pencil-thin stools. Feeling like your bowel doesn't fully empty even after using the restroom. Blood in the stool. Often dismissed as hemorrhoids, but could be something far more serious. And it's not just about the bowels. Changes in bladder habits. Like needing to urinate more frequently, difficulty starting urination or blood in the urine can be signs of bladder, prostate, or kidney cancers. Here's the part most people miss. These symptoms often start subtly. They come and go. And because they're embarrassing to talk about, many people suffer in silence or convince themselves it's just something I ate or a part of aging. But ignoring these signs can be dangerous. So what can you do to protect your health? First, keep track of any changes that last more than 2 weeks. Don't hesitate to speak to your doctor even if it feels uncomfortable. And most importantly, focus on prevention through nutrition. Foods that support digestive health and cancer prevention. Chia seeds and flax seeds. High in fiber and omega-3 fatty acids, they help cleanse the digestive tract. Leafy green vegetables. Rich in antioxidants that reduce inflammation and support healthy digestion. Fermented foods. Like yogurt and kimchi. These promote a healthy gut microbiome which plays a crucial role in preventing colorectal issues. Remember, when it comes to cancer, silence isn't golden, it's dangerous. Up next, we'll talk about one of the most alarming warning signs that should never be ignored. Yet many people try to hide it out of fear or embarrassment. Section 6. Unusual bleeding or discharge, when the body sends a clear signal. Bleeding is one of the body's most direct ways of telling you that something isn't right. And yet this is also one of the most frequently ignored or hidden symptoms, simply because people feel embarrassed or afraid of what it might mean. But here's the truth. Unexplained bleeding or unusual discharge should never be ignored. It could be an early sign of cancer. Let's break this down clearly and compassionately. Warning signs you should never overlook. Blood in the stool. This is often mistaken for hemorrhoids, but it can be an early indicator of colorectal cancer. Pay attention to both bright red blood and darker tarry stools, which could signal bleeding higher up in the digestive tract. Blood in the urine. Even a small amount of blood barely visible could point to bladder or kidney cancer. Many people attribute this to urinary tract infections, but if it persists, it's critical to seek medical advice immediately. Coughing up blood. While a persistent cough might seem harmless if it's accompanied by blood, even small streaks, this could be an early sign of lung cancer. Unusual vaginal bleeding or discharge. Especially in women who have gone through menopause, any vaginal bleeding should be treated seriously. It can be an early warning of uterine, cervical, or ovarian cancer. Nipple discharge. For both women and men, unexpected discharge from the nipples, especially if it's bloody or occurs without squeezing, could be a symptom of breast cancer. And here's the part most people miss. Many of these signs don't come with pain. They're silent, subtle, and easy to brush aside. But just because there's no discomfort doesn't mean there's no danger. What should you do? If you notice any form of unexplained bleeding or unusual discharge, even if it happens just once, don't ignore it. Seek medical evaluation immediately. Early detection can make all the difference between a manageable health issue and a life-threatening condition. I know it's a difficult conversation to have, but it's a conversation that could save your life or the life of someone you love. And while this sign is hard to ignore, the next one often masquerades as something simple, just a bit of indigestion or heartburn. But it could be hiding a far more serious problem. Section 7. Difficulty swallowing or persistent indigestion, more than just heartburn. How often have you experienced a burning sensation in your chest after a big meal? Or found yourself reaching for antacids thinking, it's just indigestion, it'll pass. For many people, occasional heartburn is nothing unusual. But what happens when that discomfort doesn't go away? When swallowing becomes difficult, or food seems to get stuck on the way down? Here's the critical point most people miss. Persistent indigestion and difficulty swallowing can be early warning signs of esophageal or stomach cancer. In their early stages, these cancers often disguise themselves as common digestive issues. That's why they go unnoticed until they've progressed to a more advanced and dangerous stage. Symptoms to pay close attention to: a persistent feeling of fullness even after small meals. Difficulty swallowing, a sensation that food isn't going down smoothly. Frequent indigestion or heartburn that doesn't improve with over-the-counter remedies. A persistent bloating or discomfort in the upper abdomen. Unexplained nausea or vomiting, especially right after eating. And here's the part most people don't realize. When cancer starts affecting the esophagus or stomach, it can narrow the passageways or disrupt the digestive process, making it harder to eat and enjoy food. Over time, people begin avoiding meals, thinking it will ease the discomfort, which can quickly lead to malnutrition and further health complications. When should you worry? If these symptoms last longer than 2 weeks, despite dietary changes and medications. If you begin to lose weight without trying or food no longer appeals to you because eating feels uncomfortable. If swallowing becomes painful or you experience frequent choking sensations while eating. These aren't just minor annoyances. They could be your body's way of alerting you to something serious developing beneath the surface. The good news is that when detected early, these cancers are more treatable. But early detection starts with you listening closely to your body's signals. Up next, we'll discuss one of the most universally known cancer signs, but one that's still often overlooked until it's too late. Section 8. Lumps or thickening under the skin, when silence isn't golden. You've probably heard this before. If you find a lump, get it checked. And yet, even with all the awareness campaigns, many people still ignore small lumps or areas of thickened skin. Why? Because most of the time, they're painless, easy to overlook, and frankly, they don't feel like much of a threat. But here's the sobering truth. Not all cancerous lumps are painful, but they can be dangerous, and ignoring them could delay a life-saving diagnosis. Common areas where lumps should never be ignored. Breasts. Lumps, even small and painless ones, can be an early sign for breast cancer. This applies to both women and men. Testicles. A painless lump or swelling may indicate testicular cancer, which is most treatable when caught early. Neck and underarms. Enlarged lymph nodes could signal lymphoma or leukemia. Abdomen or pelvis. Thickened areas or masses may be linked to ovarian, liver, or stomach cancers. And here's the part most people miss. They assume that if it doesn't hurt, it's not serious. But many cancerous lumps grow silently without causing any pain until they progress to later stages. Some even mistake these changes for harmless cysts or fatty tissue and put off getting them checked. How to know when a lump is concerning? It appears suddenly and grows over time. It feels hard or immovable when you touch it. It's accompanied by other changes like skin discoloration, swelling, or unexplained weight loss. It doesn't go away after 2 to 3 weeks. It's important to remember that not every lump is cancerous, but the only way to be sure is to get it examined by a healthcare professional. If you find something unusual during a self-exam, don't wait. Early action can make all the difference. And while a lump is something you can physically feel, the next sign is one you hear, and too often dismiss as just a lingering cold or the result of speaking too much. Section 9. Persistent cough or hoarseness, when your voice and breath reveal hidden dangers. We all get the occasional cough. Maybe after a cold, a bout of allergies, or spending time in a dusty environment. And hoarseness. That's easy to explain after cheering at a sports event or speaking for long hours. But what happens when that cough doesn't go away? Or when your voice stays hoarse for weeks without any obvious reason? Here's the crucial truth most people miss. A persistent cough or hoarseness can be an early warning sign of cancer even in people who have never smoked. What should you watch for? A cough lasting longer than 3 weeks. especially if it doesn't improve with usual treatments. Coughing up blood. Even small streaks. Persistent hoarseness or a raspy voice that lingers beyond 2 weeks. Shortness of breath or wheezing. Even during light activity. These can be signs of lung cancer, throat cancer, or thyroid cancer, all of which are easier to treat when detected early. And here's something surprising. Many people believe that lung cancer only affects smokers. But recent research shows that up to 20% of people diagnosed with lung cancer have never smoked a day in their lives. Exposure to secondhand smoke, air pollution, and even certain genetic factors can increase the risk. Similarly, chronic hoarseness can point to laryngeal cancer, affecting the voice box, or thyroid cancer, especially when accompanied by a lump in the neck or difficulty swallowing. When should you be concerned? If a cough or hoarseness persists beyond 2 to 3 weeks, despite rest and home remedies. If you experience pain when swallowing, or notice your voice becoming progressively weaker or raspier. If you also have unexplained weight loss or constant fatigue. Don't wait for the symptom to become severe. A simple medical evaluation can provide clarity and, if needed, a pathway to early intervention. And now we arrive at the final yet critically important sign, one that's often dismissed as a minor skin irritation, but could be a sign your body is struggling to heal from something much deeper. Section 10. Non-healing wounds or sores, the danger of what won't heal. You scrape your arm or develop a small sore, and naturally you expect it to heal in a few days. But what if it doesn't? What if that small wound lingers for weeks, or even months? Here's something most people never consider. A wound or sore that refuses to heal could be a critical warning sign of cancer. Where this often shows up: in the mouth. Sores that don't heal, especially for those who smoke or drink alcohol, can be early indicators of oral cancer. This is particularly dangerous because many denture wearers often overlook small irritations. On the skin, open sores or scabs that bleed, crust over, and return again could signal skin cancers, including basal cell carcinoma or squamous cell carcinoma. On the feet or lower legs. Non-healing ulcers may be linked to underlying health conditions, including diabetes, or in some cases, skin and soft tissue cancers. In the genital area. Persistent sores should never be ignored, as they may be linked to cervical or vaginal or penile cancer. And here's the part most people miss. They try to treat these wounds at home with creams and ointments, assuming they're minor. But when a sore refuses to heal after 3 weeks, or keeps recurring, it's your body signaling that it's struggling to repair itself, often because something deeper is going on beneath the surface. When should you take action? If the wound doesn't show clear signs of healing after 2 to 3 weeks. If the area becomes hard discolored, or develops an unusual growth. If you experience bleeding, pain, or numbness around the wound site. Early detection and treatment are key. In many cases, these wounds are the first and only visible signs of cancer. Addressing them promptly can save not just time, but lives. Listen to the whispers before they become cries. The body is an incredible communicator. Long before serious diseases like cancer reach their most dangerous stages, the body sends subtle, persistent warnings. But here's the question: are we listening? We've covered 10 of the most critical warning signs today, each one a quiet whisper that something deeper might be happening. These signs are often easy to ignore, easy to explain away, but they could be the difference between early treatment and a late-stage diagnosis. So if you or someone you love is experiencing any of these signs, don't wait. Schedule that doctor's appointment. Ask the difficult questions. Because sometimes the most courageous thing you can do is listen carefully to the quiet signals and act before it's too late. And if this message touched you, don't keep it to yourself. Share this video with your family, your friends, and those you care about most. You never know whose life you might change or even save with just this simple information. Thank you for watching, and until next time, take care of yourself and each other.